All right, so it's 6:30. Good evening, everyone. I'm Patty DeBoer, Superintendent in Mashpee, and you are on a Zoom call for Mashpee parents and guardians to find out more information about anything that's health or wellness related during our current COVID experience. So it's whatever you're wondering about, questions, any thoughts that you want to share. The way we want this to work this evening is as a guest or a visitor to this meeting, if you would put your questions in the chat ahead of time, and Dr. Hanscom, our assistant superintendent, is sort of monitoring the chat. And so the plan is for our district nurse coordinator, Stacy Shackle, who's upper corner in my boxes. She's going to do about a 15-minute overview and presentation of information that we hope you'll find helpful, and it may answer some of your questions, but you can start at any time to put your questions in the chat so that when Stacy's done, we'll spend that remaining 45 minutes hopefully addressing any of your concerns and wonderings. And we are recording this meeting. You probably saw that come across your screen, and hopefully we'll be able to share it with anyone else who is unable to join us in the live moment here tonight. So thank you. We really appreciate you joining us. And just to emphasize to please put your questions in the chat. And the focus of this particular meeting is on health and wellness related questions versus learning questions. But if you have learning questions, just send me an email, reach out to us. We'll address those for you. We have our school principals on this call as well. Our Director of Special Education. I know Phoebe Lambert as a counselor is on here. Joyce O'Connor, the middle high school nurse, is on here, and I'm probably missing a few. Our assistant principals at the elementary level are here, Mr. Kapolka and Mr. Prana, and the principals and
Dr. Parkinson just joined us as well, the school physician.
Dr. Parkinson is our the physician for our district, and so thank you, Dr. Parkinson, for joining us. I really appreciate it. All right, so we're going to turn it over to Stacy, but as a reminder, start typing in any questions that you have. We will not share who submitted the questions. That's confidential, so don't worry about your names. Whatever question you want to ask is the only thing that everyone's going to hear is the question, and hopefully an answer there too. All right, Stacy.
All right, so can everybody see my screen? Because I want a double screen.
No.
Yes? Okay. So, hello. So I'm Stacy Skockle, the district nurse coordinator. And tonight just wanted to take some time to go over 3 areas of focus. So our student illness related protocols and questions, and highlighting how we're doing that, masks, hand hygiene, physical distancing, and what's that looking like. And then contact tracing and quarantining, and what quarantining actually means and how contact tracing occurs in the school. So as you know, if you're attending as a parent guardian, we ask every morning that you complete the health and wellness screening, going over making sure if your child has any illness related symptoms, that you keep them home, you call your child's physician that day, review what the symptoms are, and then also reach out to your school nurses, respective schools. The symptoms that we're looking for and asking, I know we've all seen this, but just wanted to recap, COVID-like illnesses that can also be flu, strep, and other things. But if your child wakes up with any of these symptoms, that we do ask that they stay home, or if they're not under care or already cleared from a previous illness or chronic condition or underlying medical condition, or a differential diagnosis such as they have seasonal allergies and you've been working with your child's pediatrician or primary care, we ask they stay home until we have further documentation and verification on what is the cause of illness. This presentation will be emailed out tomorrow in Mrs. DeBoer's update also, so don't feel like you have to write this down. But just recapping on our attendance email, if you know your child's going to be out, or calling your respective school nurse health office line. We ask when you call the health office that you please leave the reason for absence, what symptoms, and a phone number for us to reach you back at. And if you could also include that in your emails, that would be really helpful, just so we are aware of the reason for absence and can help assess the situation more. In Mashpee, as we all are living in the COVID world, this is our new Swiss cheese model. So it's kind of a combination approach. So we know that we're wearing our masks, social distancing, however, we are saying physical distancing, cleaning, disinfecting, and hand hygiene. If you put all of these together, we hopefully are making a barrier to keep COVID away and other illnesses away. So it's a multi-pronged approach, and we're just incorporating all these strategies to keep everyone safe and healthy. As you know, masks are required for all students and staff across our schools. We do ask that you send your child to school with their own supply of additional cloth masks for them to change as needed. Every student has their type of mask that they like better, fits better. Things happen if they do play at recess or it drops or whatever, having them have what they really like and fits them best. But we do have a supply at school if the need does arise. But just a reminder to make sure that they do have a change or two in their backpack. And also dressing warmly. We go outside, warmly is a word, sorry. We do go outside and when the weather allows. So making sure dressing in layers. And again, we are trying to have windows open, such as on the buses and in some classrooms in our hallways. So just dressing in layers is just another little reminder because it is getting chillier, although I think tomorrow and this weekend is supposed to be warm. So dress appropriately for the weather. One of the biggest questions we've had recently, and I wanted to spend the primary focus on tonight's discussion, is defining and clarifying what a close contact is. You may be aware that the CDC a few weeks ago changed and defined the definition of close contact and refined it a little bit. So it is if a student or staff member or someone, family member, whatever, tests positive for COVID, in the school setting, we will identify the close contact as someone who has been within 6 feet of physical distance, so closer than 6 feet, for 15 minutes or more in a 24-hour period. So basically, each school day is kind of considered our 24-hour bubble that we look at where individuals are if they're closer than 6 feet for 15 minutes. However, with that, and what we know from COVID is the person who tests positive for COVID is infectious 2 days prior to their symptoms onset before they became sick, or if they were tested but they're asymptomatic. So whether it was tested for their job, work, whatever reason, if they were asymptomatic, didn't have any illness symptoms, we also look at with whom they've been in close contact, 6 feet, closer than 6 feet for 15 minutes, 48 hours prior to their test. So there is a little math. So it's a good thing we're in school. So what we do is we look at and keep track of on a daily basis, and this is kind of my COVID world and life right now, but it's a team effort of looking at class lists, seating charts. Power School is my new best friend, looking at schedules, where students are, with whom they are with whom staff are with, and all of our programs. So whether it's Indian education, Title I, special ed, related services, if they ride a bus, if they're a parent pickup, if someone were to test positive, I would contact Trace and ask these questions such as, do you drive your child to school? Do they carpool? Do you have, Monday, Wednesday, Friday, Johnny's mom drives and Mary's mom drives Wednesday and whatever, Tuesday, Thursday. We look at all of these pieces. We look at if students attend breakfast, our seating charts for lunch and recess, attendance daily. So if you or your child were in school or the teacher were in school for the 48-hour or the look back period from when somebody tests positive, you would not be considered a close contact at all you wouldn't even have to worry about 6 feet and where you were because you weren't here. So there's many layers. We also speak with individuals who test positive to see what else they do. Did they participate in an outside activity, athletics, driver's ed, dance, whatever the case may be. So there's a lot of data that we look at and a lot of questions that are asked of a person if they should test positive. It's also a timely and procedure that we want to make sure we're doing our thorough due diligence. So sometimes it may seem like there's a little delay, but again, with contact tracing, we want to make sure we have all of our facts and the correct data. The other challenge with contact tracing is we do not share the identity of the individual who is identified as testing positive to COVID. So I know that can sometimes feel like it's hard and unknown and you want to know or have a need to know, but confidentiality is key. We release the data if and when we have a student or staff member who tests positive in our district. That does get recorded, as you know, to the school community, and we report it to DESE. But confidentiality is maintained at all times, and it's the least amount of data and nothing that identifies the individual. So again, it's just being mindful of that, because I know sometimes that feels hard. But again, we base it on the criteria of close contact and contact tracing. If you were to be identified as a close contact, you would be identified that you have been identified as a close contact. It would be communicated with you. And we ask that you must quarantine for 14 days. And we suggest and advise testing. The trick with testing when you're identified as a close contact, and the next slide will show it a little better, is running right out to get a test if you were identified as a close contact today. Based on the date and some other data that we capture, it's recommended that you wait until you've been 4 to 5 days after your exposure. So there's a lot of discussion that goes into if you were identified as a close contact, you'd receive a phone call, most likely from myself or one of my designee that I work with the Board of Health and Meg. And we really try to do that one-on-one, not just a blanket email and you don't hear from anybody or you wait for the contact tracers, especially if it's evening or weekend. We really want to do that one-on-one personal contact, but I do ask your patience because I want to give everyone their time that they deserve, answer the questions. So it does take a little bit of time, but we want to really make sure we're thorough. Again, testing, even if you go and get a test, you still have to quarantine, even if you get a negative test result. This is the slide I was referring to, where there's the incubation time with COVID and if you've been exposed. So as this said, this is my friend Sally. She was exposed, it's day 0. So 0 is a number in contact tracing. And when we count out 5 days. So we want to make sure that if you go get tested, if I call you today and you were exposed today, we encourage you to wait days 4 or 5 out to get a test. So we refer you to your primary care, or we'll help you identify areas to get places to get tested. And but we want to encourage testing, but making sure that it's not too early. The other piece I've realized is we don't all understand what quarantining actually means. So if you were to be told that you were identified as a close contact, you are going to be informed that you need to quarantine for 14 days, and that starts effective immediately. So if we become aware of someone testing positive and it's the school day, we send individuals who are identified as close contacts home as soon as they're identified, with the expectation that you go home. You do not now go to the grocery store, do some errands, do other things. You actually go home. And if you are the person identified as a close contact, these are the guidelines. And again, it'll all be emailed to you and available. But to separate yourself as best you can from other members in your household, so that should you become symptomatic or test positive, you aren't spreading it to others in your family or that you're close to. So being prepared ahead of time is really, really important. If you can have a separate bedroom, separate bathroom, have a supply, the next slide will show a little bit more of things. You are still able and encouraged to seek medical care, but when you're in quarantine, it's very important to let people know that you are in quarantine, because that will further have a discussion with the healthcare providers you're speaking with. This link will be emailed and accessible too. It kind of goes over the 10 steps to quarantine and how to make it work really well, and things to have ahead of time. So again, having your supplies, being prepared, being able to stay in your room or area that you identify for 14 days. So do you have what you need? Do you have medications? Do you have cell phone chargers and things to help you get through this challenging time and not have to get into other people's spaces?
I don't know if you guys will survive if mommy has to quarantine for 14 days.
The travel guidelines and protocols have been sent out, I know already. We'll be resharing them with travel and holidays coming up. So just highlighting them here again. The link in the website is available to you. But basically also, if you travel and you do not have a negative test that was done 72 hours before you return to Massachusetts, you need to quarantine until you get a test, and it's a 14-day quarantine if you're not tested. So again, it's the same kind of piece of information. So again, our goal is to stop the spread, or slow the spread at least. Ultimately, we'd like to stop the spread, but definitely slow the spread of COVID. And lastly, I just wanted a reminder, you all have been doing an amazing job between calling in, keeping your kids home when they're sick, and then also the flu shot vaccine, having those turned in when you have them done. If you need help accessing them, reach out to your nurses or myself. But again, the flu vaccine is required by December 31st for everyone, whether you're remote, hybrid, or in person. But again, I appreciate all that we've been getting. Terry, Joyce, Sarah, and I are receiving them daily. So it's really awesome, and we appreciate that support. As you know, you can reach me. That is my cell phone number. Really, seriously, I mean it. Reach out, ask a question. Please, I'd rather hear information or be asked something 100 times than not at all. All staff know that too, but communication is key. So I greatly appreciate everything that everyone's doing, and thank you.
Stacy, before I get into questions, and actually this is a Patty DeBoer question. I know we're recording this, so it'll get sent out. Will the slides be sent out also? Yes?
Yes.
Oh, you were not, okay.
We're going to not only send the video of this meeting, but we'll have the slides as another attachment as well.
Great, because some of them were small and there was lots of good information on there. So I want to make sure people will see them. Before we get to questions, is there anything else anyone wants to say on our end before we start?
No, I appreciate all the work that Stacy's doing, and also all the work that our families are doing. I do truly feel like we are collaborating as a community to try to keep our schools open and being able to follow the learning plan that we currently have in place. I mean, obviously the desired plan is 100% in person. That's not our reality right now, but keeping what we do have in place is the goal that we have, and everybody's staying healthy. So I do appreciate all the effort. And, you know, I also acknowledge, I've said this to several people today, you know, we're sort of entering a pandemic fatigue stage, which it is what it is. And we just have to sort of be in it together and support each other through it. It is going to get better. But it's, you know, it is our reality. So reach out to anyone that you need to, if you need support when, you know, because we all have our highs and lows at different times, and hopefully we balance each other out. So I don't know if Dr. Parkinson, if you have, I mean, I'm not trying to put you on the spot, but if you have any wise words to share, you're welcome to at any time.
I think I just echo what you just said, which is that, you know, it's hard. What people are doing is hard, and for multiple reasons. And I think in addition to just persevering, just encourage people to be patient. Um, Everyone in the medical community wants um, testing to be done as efficiently as it can be, and everyone understands the challenges that people face, and but at the same time, it has to be done a certain way to be safe. And so if the nurse says it's this certain day, then please, you know, ask your questions, but ultimately understand and do as you're asked.
I agree. Thank you. All right, Dr. Hanscom, do we have any questions in the chat?
We do. So the first question says, I feel like my child has a runny nose a lot in the winter. Am I supposed to keep my child home every time they have a runny nose?
So great question. So often runny noses, if they're not accompanied by other symptoms, that especially if your child has allergies, is feeling well, trying to just manage that, working with your healthcare provider, note on file that they do suffer from allergies, and just touching base with your provider to make sure that it's really always their winter thing that they get, helping, working, managing, making sure they're well hydrated. If you do use any over-the-counter medications, nasal spray preparations, and just trying to manage those the best. And as long as, you know, within 24 hours, they haven't spiked a fever, it's under care, managed well, and your healthcare provider has confirmed that it's, you know, no need for any further evaluation. They don't develop other symptoms, they can come to school.
Okay. The next question is, and just a reminder, if you came on after we started, you throw your questions in the chat. They come to me. I read them out loud, and we go from there. So the next question is, are the schools, KCC in particular, doing random testing? I've heard that some schools are doing this, like testing 20% of the school every week. If not, are there plans to start this given the ongoing increase of cases in recent weeks?
So I'm going to let the two health professionals expand, but the initial answer is no and no. But feel free to share your thoughts.
So no and no at this time. However, we are working with, and there's lots of initiatives out there to look into having that as an opportunity. So we're not closing any doors. Board of Health is aware of looking at various opportunities that come. It would not be testing that would be done without a parent guardian, especially KCC. It would be after school hours. It would be with parent permission. You would know about it. It would be voluntary. It would be no just random children coming in. It would be a very well thought out, controlled, Dr. Parkinson orders signed off, and you know, correct PPE and all of that. And it would be a collaborative approach. There are actually quite a few opportunities in the pipeline, but right now at this time, there's nothing scheduled. But it's always a possibility, but you would be informed.
There are two main impediments to doing it, is the cost and availability of supplies. As you've seen, the you know, professional sports teams, college teams, even a lot of college campuses, some workplaces are doing screening, and there is a real value to it. But as I said, there's also a significant cost to it. So the main times when it might become available were if the government were to do a program, you know, if the state made screening programs available, or occasionally universities will offer this kind of thing free of charge while they're testing a product, you know, prior to its approval. So it would be nice to do. it's just not practical right now, unfortunately.
Okay. And I would add too that if you have any symptoms, you are still to go to your doctor and you would be able to get a test going through the regular channels. So this would be sort of universal type of screening, random screening that we were talking about, not if you're not feeling well. I just want to make sure that part's clear, that you do go to your doctor if your child is not well. Okay, are gaiters allowed as masks in school? I think probably not, but if not, why?
So gaiters from the Department of Public Health and DESE are not advised as face coverings. So it is, our guidance is that we have ear loop masks so that they are the ear loop, cover your mouth, nose, and chin. And ear loops are the types of masks that we are requiring.
Can you just explain though why? I know, and for those of you who don't know, DESE is not a person. DESE is the Department of Elementary and Secondary Education. And having done now a lot of these calls in the last 7-8 months, we realized we should explain that when we're talking. But what's the problem with the gaiter, I think is what the content of the question is.
Sure. So when you wear a gaiter, so if this were a gaiter, yes, I could make it cover my nose and mouth, but it may not stay up well. And then I've just been on here, it's touching it, I'm touching it, leaning. So when there's correct protocol for taking your mask off. So when you take it off, making sure that the side that touches your face is facing up on your tissue or paper towel. And then when you put it on, you're not touching the outside that might have, as I call them, cooties, or your cooties on the inside. So gaiters just are up and down, and they're not, according to DPH, Department of Public Health guidelines, and Department of Elementary Secondary Ed, the recommended and required face covering at this time.
Okay, great, thank you. Are kids kept 6 feet apart during recess?
That's a great question. So we work hard at trying to set up their play areas and cohorts, but we do know that recess cohorts they don't stay 6 feet apart for the whole time. What we have is our recess monitors working hard to make sure that they're not spending 15 minutes in their personal space, setting up activities that discourage close contact and or playing with the one same person. But we, depending on when and how things roll and where they play and what activity they're participating in, some are going to be considered a close contact type cohort. But again, it will be an issue when there is a positive case. Not everything is COVID. So we do monitor that. We also I monitor the weather based on recess. And our assistant principals here just love having a rainy indoor recess day. Not really. But I like those because I know the kids are at their 6 foot distance. So we also, with contact tracing, do track if it's been indoor recess or outdoor recess. So that also comes into play. So long and short answer is not as a general rule for the whole recess, but we try to discourage the 15 minutes in personal space.
So the next question is actually the same one, but with buses. And maybe I should answer it, since
Go for it.
I don't have my bus hat, but somebody gave me a I love buses hat. The busing it's a zigzag approach. So there's a student in one seat on the aisle, one seat on the window diagonally across, and so forth. We can have up to 23 seats used. One of those is taken by a monitor, and siblings can sit together. So with all of those protocols in place, they're still not 6 feet apart. So Nurse Stacy has all of the bus seating charts and the attendance that the bus monitors or the drivers take every day. So we know who has ridden and where they've sat every day, so she could contact trace if needed. I will say to families, if you can the kids have been amazing with this, but just reiterate that if the bus monitor or the driver asks you to sit in a particular seat, then you need to sit in that particular seat. And sometimes the following week that you come, it might be a different seat because we're adding kids to the bus and based on the routes, your seat might change. So wherever they tell you to sit, please sit. And like I said, the kids have been fantastic with it, but any chance I get to talk about busing makes me happy now. Did I miss anything, Stacy?
No, that was great, but we do track. So I really do look at the bus seating charts every day and attendance, and they're dated so that if your child is changed on Wednesday, then that falls into my contact tracing window. I know where they sat each day. And the same goes for lunch and breakfast seating charts for all the schools. So.
Okay. What number would the call come from? So if, let's say there is a case and I am identified as a close contact, what number would the call come from so that we can be vigilant to certain numbers?
So I would put my cell phone number that is in the slide. You'll have it. It's been in all the letters because I call from that number. And if for some reason it were a different number or we had helpers, we will leave a message to tell you why we're calling, who we are. So we do ask to please answer the call. If you see an email go out that you'll be contacted and it's a number you don't recognize, that would probably be a safe day. And if it's a telemarketer, you have my permission to hang up. If it is I, please don't hang up. Answer the call. And if I don't reach someone, I do leave a voicemail with asking that you call me back and identify myself and my number.
And Stacy, would they ever possibly receive a call from the VNA or any other outside of the school district?
So when I speak with you, I will tell you, depending on the day and the time, from whom you'll be getting a follow-up call. So yes, so it'll either be the contact tracing collaborative, which will come up as mass.gov COVID, or the COVID line, or Cape Cod Healthcare.
So the long and short of it is, you can't just stick a number in your phone necessarily and assume that's what it will be.
Correct.
It could be a number of things. So, but the message will be left with a number to call back if you do happen to screen, as I tend to do.
Correct.
Because I did get that call today that said that there was a warrant for my arrest. Has anyone else gotten that call? And it's like yeah, see, I'm not alone in this. So I get how people don't necessarily always answer the phone, but the message will be left so that you'll know who to call back.
And a message will be left, just to add to that, when it is a contact tracer follow-up after our close contacts have been identified, and they will leave a message, and they do ask that you do please return their call.
Okay. The superintendent sent out an email regarding a travel form that needs to be submitted for anyone traveling out of state. How is the school making sure that families are indeed sending in this form and quarantining their children as relevant so that other families can feel safe that exposure from the outside is not being brought into the schools?
So that travel form is actually a state travel form. It does not get submitted to the schools. If you travel and you're traveling from Massachusetts, it's your responsibility to submit that, and it goes to the state. What we are asking for is your negative COVID test. So again, it's honor system. It's being open and honest. I have to say, people have been really good about letting us know if they've traveled or when they're traveling or what's coming up. We are tracking the dates. We are working and figuring out with you that what we need. And if we do find out after the fact that your child's returned and has traveled, they will be isolated at school and you'll be called to pick them up. So we are asking that people just be honest, give us the heads up. We'll help you with following up with making sure testing and those things are done and that we have your results.
Yeah, I definitely support what Stacy said. We really are in this together, just like the daily assessment you do on your child as families. There's a lot of trust involved with that because we don't collect those. We don't require you to do it on a computer. We really rely on you making really the best choice for us, for your family, but also for us as a school community. So it's an honor system.
Okay, and I'll add, just as with the honor system, that there are individuals at school who have health conditions that it could be very dangerous for. So it's an honor system, and it's really important that we're thinking about sort of the teachers, everyone who was in that building with our children. So I'm just gonna get off my soapbox for a minute now and go back to reading questions. This one says, I find the close contact and quarantine regs very confusing. Why can Sally, oh, they use the name and everything. Why can Sally test negative on day 5, but not return to school? But a traveler returning to the state can avoid quarantine by testing 3 days before their return. I'm missing a key detail and I hope you can point it out for me.
Well, that's called the state loophole. I didn't write these guidelines. We still really don't want people, if you don't have to travel, but that is one of the loopholes. The other piece to that, though, is with travel, you have not been identified as a close contact. You have, traveled for whatever reason, so you are not a known close contact at that time. Now, mind you, could you have been exposed? Could you be positive? Yes. The whole travel testing and guideline of that testing 3 days prior, there's lots of loopholes to the travel piece itself. But the real issue with quarantine for close contact, that is, we know, or you've been identified as being exposed to somebody who's positive, and we know you're a close contact in that situation if we've identified you as a close contact to someone who's tested positive. So that really is the key point. And you can, as a close contact, become symptomatic even on day 14, which is why it's the 2-week quarantine period, even if you test negative. So that is the piece, but you're right, there is some inconsistency to that. But the key missing piece is that you've not been identified as a close contact to someone who is positive.
Okay, this is sort of a similar vein with the travel, but it's backwards. So if I travel, I have to fill out that form for the state and do the negative COVID test. But what if I have family who's coming from out of state to visit me over the holidays from a state that has high, that's on the naughty list or whatever it's called? I made that part up. That wasn't written, but.
No worries. So each state has their own travel guidelines. And if you are traveling into Massachusetts, there's guidelines for where you're coming from and what you have to do. So again, there's honor system. Many people are being cautious and doing their due diligence and having people who come visit test. But again, it's not a perfect science. And depending on how you're traveling, there's no guarantee. There isn't a guarantee on if you tested 72 hours before you traveled that you didn't sit next to somebody on a plane, train, or in an automobile that's positive. So again, that's where the whole piece is about physical distancing, hand hygiene, wearing your mask, even when you're doing your family visitors, gathering sizes, it's 10 or under. I know it's not a fun time. Everybody keeps telling me that I'm just not making anything fun anymore, including my kids. But it's just being safe and putting all the pieces together and just working hard.
So I think the point of the question was less about what the people coming have to do and more about like, if people come here and they stay in my house, do I have to do anything? And that's where you're saying it's the hand washing and the distancing and the mask.
And
but
making sure
like
people,
form or anything.
No,
Okay.
there isn't a form. It's just, but it's again, being mindful. And if anyone becomes symptomatic, having them be tested and isolate/quarantine, stay away from anybody who has any symptoms if they develop when they come. And that open communication. And if you have questions or something comes up, just because what Auntie Sue didn't, isn't part of Mashpee Public Schools, I will still help you answer those questions. So reach out and ask, and every situation is different. Every scenario is different. I haven't had the same one yet. So just keep asking.
All right. You're killing it, Stacy. Thank you. We're not done. Sorry. Say my child was with one of her friends and whose friend tested positive. So not my child, not her friend, but the friend of the friend. Do I need to do anything like keep my child home, have her tested, quarantine?
So if your child is not identified as a close contact, but they're a contact of a close contact, depending on the scenario. So if it's if that friend, if your child's friend tested positive, as long as that middle friend is asymptomatic, you don't have to worry. That being said, there are some situations we're seeing in families and households, if there are individuals who may share bedrooms or close contacts, or if somebody is symptomatic, but they've not been tested positive. So again, in the scenario that's been shared, no, your child would not have to quarantine. But again, you're watching for symptoms. However, if that child that's been identified as the close contact tests positive, then your child would be considered potentially a close contact, depending on when they hung out last. And then you would have a conversation about close contact. So again, it's just looking at all of the pieces.
All right, here's another one. I have 4 children, which this is not me. If one of them tests positive, do I keep them all home from school?
So again, if you have an individual who tests positive, then you'll be contacted by a contact tracer, and or if you're obviously one of our, I call them my kids, so they're my kids, I want to know about that positive, then we're going to have a chat. So if you're in the same household, so think about it, breathing the same airspace, individuals in a household, when someone tests positive, everyone, as a general rule, quarantines, is considered a close contact, would get tested. So your answer would be yes in that scenario as shared.
Last spring, one of the symptoms that was showing up in children was a rash. Is that still a symptom?
So Dr. Parkinson, if you want to take that one, I have not heard that as a primary symptom at this time.
Yeah, the list is just about anything you can think of. It's kind of like it's like any prescription package you open, every symptom known to man is mentioned. With rash, rash is not usually difficult to figure out as something else. So, if in doubt with rash and it's not something obvious like your child's eczema that would be easily identified, or, acne or something like that, then that can usually be clarified with a quick visit with your provider. I don't, let's put it this way, I'm not worried that we're missing a lot of COVID that's coming into the school as rash.
Great, thank you. Next is parent permission required for a student to receive a COVID test, a temperature check, or an injection of any kind? And does the current medical form in their file grant advanced permission for any of those?
So testing would require parent permission, would be a set form. There would be a whole protocol, and we're not doing that. As far as temperature check, we do not do daily temperature checks. The CDC has shown that is not a valid use of time and resource or identifier. If your child does come down to the health office, however, all of our school nurses use temperature checks as part of our assessment for illness if it's an illness-related visit.
Okay, I have heard of several different types of COVID tests. Is there one that I'm supposed to get over the other?
Great question. So the Department of Public Health at the end of August released that through Department of Elementary and Secondary Ed, that we are only able to accept, and our Board of Health also is requiring this, what's called a PCR test or the rapid molecular test. So it's a PCR test, not the antigen test and not an antibody test.
Okay. Okay, just to be clear, if we are contacted as a close contact and we have a negative test, my child still has to be out of school for 14 days, even though they don't have COVID. I have also heard that the person who has tested positive may return if they have a negative test. So I'm still confused.
So great question.
I can
Go
take
ahead.
it on. The short answer is yes, it's confusing. The long answer is if you are a contact and you test negative, yes, you still have to remain out for 14 days. You can be relatively reassured that your child is not going to develop the illness, but the nature of exposure is that it can take up to 14 days to develop symptoms, and that's why the two things are there. And it's a challenge, there's no question. When somebody has been diagnosed with COVID, they're out for 10 days, also including no fever and improvement of symptoms. The reason for that length of time is because after the 10-day mark, a person's contagiousness is felt to not be significant, and they do not have to have another test to show that they're negative. You're not the only one that's confused. It's taken those of us that are doing it months to get it straight, and so it is as difficult as you think it is.
It actually makes me feel so much better to hear both Stacy and Dr. Parkinson say that, just putting that out there as a parent and an educator.
Just to circle back on the rash issue, I went back to the CDC site and it is not currently listing rash as a symptom.
Okay. And I was going to just add to that last question about being confused and how it's sort of ever changing. That's where Stacy really is your best resource, reaching out to her with any questions, because if she doesn't know the answer, she's going to find it for you, or she's going to help you figure out where to find it. You're not expected as parents. We are not expected as parents to be experts in this. We're just expected to do our best and communicate with the school so that we can keep everybody safe as best we can. So those were all the questions in the chat. I don't know if there are any other comments that anyone wants to make.
I just want to say, I just want to encourage families to reach directly out to whether it's myself or Stacy with anything, you hear rumors. There just seems to be oftentimes things get out there and it's misinformation, and it sort of creates a level of anxiety in our families. And it really needs to be, if you hear something, you need to directly ask, like myself and Stacy. We will give you the answers that you need and clarify any of the misunderstandings and the, I guess, misinformation that sometimes gets shared. And I mean, that's normal. We live in a world that's just rampant with misinformation, but this type of information where it causes a lot of anxiety and stress, really, we need to make sure we set it straight for you. We've so, knock on wood, are doing a great job. But I know there were a lot of rumors swirling around the positive cases that we did share probably almost 2 weeks ago, a lot of misinformation. And it just, like, if people come up to you and share information or ask you questions as a member of the community, just keep directing them, check with the school, go back to the school, get the information from them. Don't just keep repeating things that you're told or you hear. I would appreciate that anyway. Thank you.
Well, I think it just serves everyone better that way. It's always the case for these evenings that we have, that when I say we have no more questions in the chat, and then more questions come in, which is great because that's why we're doing this. So we have a couple more, or a few more. Circling back to the question about parent permissions, does the current medical form give advanced parental permission for injections of any kind, like a vaccine or a flu shot or anything, regardless if the student who's under 18 wants one?
No, we don't do any immunizations, injections that way. It would be a whole separate permission.
Okay. This next question is, if a student is quarantined, will they be able to be remote for that period of time?
Yes, that's, I mean, what we've done, I think, with our system and connecting all students with, their set teachers, it does allow for that flexibility. So pre-K to 3, we would need to make sure materials got to you, but we have a system for doing that for your child because they are generally 100% in person. But with our remote students in our hybrid students, grades 4 through 12, you just become remote and you don't have an in-person week. So the week on, week off also lends itself to this sort of format the best. But yes, you absolutely will continue. Your child should continue learning if they're feeling, well enough from a remote place.
Yeah, so your first call is to Stacy or the nurse in your school, but your second call or email is to the teacher. And you can, once you know that the child's going to be quarantined, you can email that teacher, your child's teacher or teachers, and just let them know they're going to be remote for the week. You don't need to give them information, or anything like that. But that's how you would sort of communicate that piece. Okay, the children sometimes have snack in the classroom, which requires taking off the mask. Is this safe? If a student in the class tests positive, would everyone in the class be considered a close contact since the necessary protocols like being masked and 6 feet are not met during snack time?
Great question. So snack time is under 15 minutes. Yes, obviously masks need to be removed, but snack time is done in a quiet, no talking, everyone facing in the same direction, everyone 6 feet apart. So it does not constitute a close contact.
Okay, so it looks like that's, wait. Oh, I got to thank you all. I just want to make sure it wasn't another question and that they wished more parents and guardians took advantage of this meeting. But again, it's being recorded and will be sent out to all families to watch. So they will be able to access the information. That is it on our questions. So I don't know if we want to just, Mrs. DeBoer, if you want to end it with anything?
Well, and I just, again, remind you as well to reach out to your school principals if you have any kind of questions about anything. I mean, we don't consider ourselves the health experts. We have Dr. Parkinson and Stacy, and my gratitude to them. They read everything that comes out like daily and they keep up with the latest. And then I kind of get the Cliff Notes version, which I greatly appreciate. But I just really, want to emphasize to everybody that, first of all, thank you for joining us this evening. And I realize not everyone can, and for whatever reason. And then again, the message of gratitude and positivity and flexibility that we are going to make it through this. And, tomorrow we will share this with everyone as well. But anytime, we have a great team here that is more than willing to provide any kind of supports that you need as a family. So whether it's a health question or food issues or financial burdens, we are a resource for our families, and this community does a great job of taking care of families and putting students first. So whatever it is you need, as long as we know about it, we're going to help you. So you got to reach out. And I thank everybody for being here tonight. I don't know if any principals have any you don't have to say anything. I appreciate you being here as well. Guess that's it.
I just want to give a shout out to Joyce O'Connor, our high school nurse, and Terry Richards, and Sarah Pockras is the nurse at Casey Coombs, because without them, I could not do this. So they're answering a lot of calls, helping make a lot of calls, and that communication is key. So I am truly grateful for this team and our administrators, but my nurses rock.
Yeah, absolutely. They do rock. And also I'll give a shout out to DPW, because just so parents know, we are really diligent about the cleaning and disinfecting that takes place in our buildings. There is a set schedule and an expectation of what gets done during the day and then what gets done in the evenings. And it really, you can feel good about the fact that we have created a really safe environment for our employees and especially for our students. So thank you to the DPW for all that they're doing for that.
And while we're talking about giving thanks, that's just a reminder to try to keep the gatherings small over the holidays.
Yes.
That was a great segue. We're getting lots of thanks in the chat from families just you know, which we always appreciate, but we also like the other kind of feedback. So anything that questions you have, anything you need, as Mrs. DeBoer said, that's what we're here for. So thank you so much, everyone, and have a good night.
Bye, everybody.